LPN Practice Test Nursing Study Guide and Review, 25 Critical Questions. Question 1. Which task can an LPN delegate to an unlicensed assistive personnel, UAP? Feeding a patient with a high aspiration risk, ambulating a stable post-op patient, giving oral medications, assessing a new admission. UAPs can perform tasks on stable patients like ambulation and ADLS. Question 2. A patient is receiving warfarin. Which lab value is most important to monitor? Hemoglobin/HCT, point/INR, APTT, WBC. Point and INR are used to monitor warfarin, Coumadin, therapy. Question 3. A client is scheduled for surgery. The LPN notes the consent form is not signed. The LPN should sign the form for the patient, ask the surgeon to obtain the signature, witness the signature after the patient receives anesthesia, cancel the surgery. The surgeon is responsible for obtaining informed consent. The nurse witnesses the signature. Question 4. What is the priority assessment for a patient taking furosemide? Heart rate, blood pressure and potassium level, temperature, bowel sounds. Furosemide is a loop diuretic that can cause hypotension and hypokalemia. Question 5. A patient with a hip fracture is in Buck's traction. The LPN should ensure the weights are resting on the floor, the weights hang freely, the patient's feet touch the footboard, the traction is removed every 2 hours. Weights in traction must hang freely to maintain the correct pull. Question 6. Which food choice is high in potassium for a patient with hypokalemia? White bread, bananas and spinach, apples, rice. Bananas, potatoes, and spinach are high in potassium. Question 7. A patient has a butterfly rash across the nose and cheeks. This is a classic sign of psoriasis, systemic lupus erythematosus, SLE, eczema, rosacea. The malar, butterfly, rash is a hallmark of SLE. Question 8. When administering an IM injection to an adult, the preferred site is deltoid, ventrogluteal, dorsogluteal, vastus lateralis. The ventrogluteal site is the safest and preferred site for most IM injections in adults. Question 9. A patient's blood glucose is 50 mg/dl and they are conscious. The first action is give 15 g of simple carbohydrates, administer 4D50, call the doctor, give a high-protein snack. The rule of 15 suggests 15 g of carbs, juice/glucose tabs, for conscious hypoglycemia. Question 10. Which precaution is required for a patient with tuberculosis? Contact, droplet, airborne, standard only. TB requires an N95 mask and a negative pressure room, airborne precautions. Question 11. Nitroglycerin sublingual tablets should be replaced every 1 month, 6 months, 2 years, when the bottle is empty. Nitro tablets lose potency and should be replaced every 3 to 6 months once opened. Question 12. The LPN is caring for a patient with C. difference. Which hygiene method is required? Alcohol-based hand sanitizer, soap and water only, gloves only, no special hygiene. C. diff spores are resistant to alcohol, hand washing with soap and water is mandatory. Question 13. Which position is best for a patient with shortness of breath? Supine, high Fowler's, left lateral, Trendelenburg. High Fowler's, sitting upright, allows for maximum lung expansion. Question 14. A patient on digoxin reports seeing yellow halos. The LPN suspects normal side effect, digoxin toxicity, worsening heart failure, Need for glasses. Visual changes, yellow halos, are a classic sign of digoxin toxicity. Question 15. What is the normal range for an adult heart rate? 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 120 to 140 bpm. The normal resting heart rate for an adult is 60 to 100 beats per minute. Question 16. Which of these is a right of medication administration? Right patient, right color, right flavor, right hospital. The rights include patient, medication, dose, route, time, and documentation. Question 17. A patient has a suspected spinal cord injury. Which technique is used to open the airway? Head tilt, chin lift, jaw thrust, nasal trumpet, hyperextension. The jaw thrust maneuver opens the airway without moving the neck. Question 18. Which finding is most concerning in a post-op patient? Pain 4/10, urine output 15 ml/hour, temperature 99.0 F, drowsiness. Urine output should be at least 30 ml/hour. 15 ml/hr indicates potential renal failure or shock. Question 19. A soft diet is indicated for patients who have high blood pressure, have difficulty chewing or digesting, are obese, have kidney failure. Soft diets are for patients transitioning from liquids or with mild GI issues/chewing trouble. Question 20. What is the first step when a patient is found on the floor? Call the family. Assess for injury and level of consciousness. Fill out an incident report. Put the patient back in bed. The priority is always patient assessment, safety and ABCs.